Hi, I'm Dr. Lichtenstein, Medical Director at AgeWell, New York, Dr. L to you. And today we're going to talk about one of my favorite topics, and that's the confusion between memory loss and Alzheimer's disease. A lot of people get very nervous when they think that just because they have some memory loss as they get older, that they're suffering from Alzheimer's disease. And nothing could be further from the truth. Short-term memory loss is something that's pretty common as we get older. We can't remember things we did just a few days ago, but we can remember things that we did years ago. Alzheimer's disease is a more serious disorder where you have organic or mental dysfunction. If you had Alzheimer's disease, you wouldn't have short-term or long-term memory, and you'd be having episodes of confusion. One of the things that we can do by ourselves or with our doctor is to do a quick test to see how we're thinking. And that is something called the three-object recall. What you do is you take three common objects: a pair of glasses, a dollar bill, and a coffee cup. Three things. And then go about your business for about 5 or 10 minutes. And then go back to yourself and say, now what were those three things? If you can remember all three things with no problems, you have no problem. If you can only remember two things, you may have a slight problem with your memory or the way that you've been thinking. And obviously, if you can't remember any objects or only one object, it's time to go see the doctor. There are things that we can do to improve our memory, little tricks. Is crossword puzzles or dominoes. Any kind of board game that'll help you concentrate. Bridge, card games, read, draw, get out and do things. The more active you are, the more active your memory stays. Just write stuff down. As we get older, especially doctor's appointments, medication that we have to take, there's something about writing and thinking that kind of goes hand in hand. And this way, generally speaking, you want to interact with your physician or whoever your healthcare provider is if you're feeling confused or having memory loss. But feel free to call your AgeWell care manager, especially if you have any questions, and we'll be always glad to get back to you. So have a good day, and we'll see each other again on our next topic.